Thanks so much for joining me.
Thank you, Ruth. Glad to be here.
We reported last month the DOJ has found that Idaho has essentially segregated adults with disabilities in Medicaid-funded nursing homes. This is not something that is surprising to you. You flagged this before. Has it gotten any better? What are your concerns?
Yes, I appreciate the question. Yes, the Department of Justice came out with its findings and essentially found that people with disabilities were being segregated unnecessarily in nursing home settings when they could be being served in our Medicaid-funded home and community-based services. The issue with this is that this is not a new issue. This is an issue that was brought to light in 2023 through the Office of Performance Evaluations report on the sustainability of the direct support workforce in home and community-based services, which basically said that Medicaid rates are not kept at pace for our service providers to both recruit and keep our direct support workers. This has meant that our service providers throughout the state have not been able to keep enough staff. They've had to turn people away. And what that means is for people with disabilities and seniors is that they are turning people away to nursing home placements that are costing public dollars in the amount of $85,800 a year per person. And people with disabilities and seniors could be served at a fraction of a cost if they were served in home and community-based services, but the investments have to be made in our home and community-based services in order for that to happen. So those recommendations in the Office of Performance Evaluation report were made in 2023, and the disability community is still very concerned at watching the continual decline of people with disabilities and seniors ending up homeless, ending up having to move out of state because there is no placement here. So they're moving from their home community that they've always known and their family to a state that they don't know anyone. Also, family members are having to either quit work or take reduced hours in order to provide those additional caregiving responsibilities for a senior, for their parent, aging parent, or for their adult children with disabilities, or children with disabilities. And so this is causing a lot of pressure on families, and we're not sure when this will get resolved.
Let's talk Medicaid. How confident are you that Medicaid expansion will be in place, will continue to stay in place, and what are your concerns around it?
So I have a couple of concerns to talk about, and one is at the federal level. And so right now, Congress is considering a proposal to move to a different Medicaid structure. And there's two different things that they're considering. One is a per capita cap, which means that the funding for state Medicaid programs would move to a fixed amount per person in the Medicaid program. This does not account for varying medical costs, crisis, a pandemic, healthcare, rising healthcare costs. And in Idaho, because we have a medical shortage for specialty services, we have a lot of people who have chronic health conditions and just specialty needs where they have to travel out of state. So it doesn't account for any of those costs. Once we get that budget based on a per capita cap, that's the budget we have. So what ends up happening is that the state is then on the hook for that additional expense, which will be difficult for Idaho to absorb.
There's legislation happening in-state as well. What are some of your concerns around that? And I guess you work with the disabilities community. I mean, how does it bring concern from them?
A lot of concern about the discussion of repealing Medicaid expansion, which has to do with our caregivers, our families who have taken reduced hours at work, who are not working because they are caring for that adult family member or their children, because we don't have the direct care workforce to do that. And those people rely on Medicaid expansion. The biggest benefit to people with serious mental illness, which is the majority of people who access Medicaid expansion here in Idaho are people with serious mental illness. 1 in 3 adults have serious mental illness here in our state. Before we had Medicaid expansion, they had no access to prevention, they had no access to medication, and oftentimes they just became sicker and sicker, and this would also go for people with chronic health conditions, until they were just so sick that sometimes by the time that happened and the County Indigent Fund or the Catastrophic Health Care Fund could pick up any type of help, we were looking at end-of-life issues for so many people. So there was no prevention before Medicaid expansion.
So much of this comes back to the direct care workforce shortage. What can the state do? What would you like to see happen to improve that?
Well, one other thing to consider is that 25% of our direct care workers in home and community-based services benefit from Medicaid expansion.
Because of their
low
salary.
rates.
Yeah.
So we would like to see, at least on an every other year basis, half of those service providers within our home and community-based services get a cost study. That cost study goes to the legislature, and those rate increases are provided on a biannual basis so that our service providers can keep up with paying people what they're worth, but also investing in really quality training for the direct support workers who do really complex work. They have to be on their feet, thinking all the time, problem solving quickly, and they're dealing with all kinds of things from medical conditions to certain strategies around supporting people who may have complex behavioral challenges. So it's not a job that you can just walk in and do it. There really needs to be some skilled workforce to be able to, what I like to think of as make a person's day the best day possible, which I think is the role of our direct support workers for people with disabilities and seniors.
Do you think state lawmakers are hearing the concerns from individuals with disabilities who are crying out?
I think there's been a lot of coverage, but for whatever reason, it doesn't seem to be getting through to our legislature about the need to invest in our home and community-based services and figure out a way to really make sure that those rate increases that they do provide, they have been providing. It's just that we have a lot of different providers within our home and community-based service system. So it sometimes can be confusing that, hey, I gave a rate increase last year to that. Why aren't we done talking about this? But there are a number of different providers within our service system. So I think there also needs to be a way to ensure that those rate increases, that a certain amount is actually getting to the direct support worker either through wages or benefits. And also really the need for quality training.
And when you say those are the individuals who are helping the disabled person rather than the provider, that's what you're getting at.
Correct.
Getting the wages
The
to
actual
them.
people doing the work of supporting people.
Okay. Christine Pisani, thank you so much for your time.
Thank you.
I appreciate it.
Thank you very much.